Hello everybody, and welcome to another episode of Fun Facts at the Pharmacy. If you've never watched the show before, I'm your host, Dr. Christopher Greider. I'm a pharmacist who works for Marks in the Northeast Ohio area. The intention of this show is to help everybody kind of get a better idea in regards to making good health choices, because there are times where you can't get a hold of somebody, whether it be your physician, pharmacist, or nurse. So in order to make good choices, this is the information that you would need to kind of help with that. So for the beginning part of this, we always do a section called Fast Acting. And the point of this is to kind of get you some basic information thrown out there. So this covers anything from if there's legislation that's available, any changes to the healthcare system that's going on, or just general tips to kind of have a good and healthy lifestyle. So for this one in general, what we're talking about is annual checkups. Now, I get a lot of questions because a lot of people complain about getting their annual checkup done. The purpose of these exams is to try and help you find things before they actually get worse. A lot of times early diagnosis can lead to a lot of treatment, so a lot of different things such as cancer or even like pelvic pain problems. There's something that's always underlying or causing it, so that way when you first start with symptoms, it's always a good idea to get that checked out. Now, to kind of give you any idea or context, most people don't typically require any form of real checkup until you start hitting the age around 30. Around 30 to 65, they normally do recommend that you get an annual checkup anywhere from 1 to every 3 years. The purpose of this is just to kind of make sure that all of your numbers are staying the same and that everything's okay. Now, the other part of it is if you have any existing conditions, so we're talking if you have heart conditions, if you have high cholesterol, high blood pressure, diabetes, these are all conditions that could merit the actual annual checkup sooner. So you may be getting them once a year if you have these conditions. So anybody that's type 1, type 2 diabetic, these are common things that you'll typically see. But besides that, I mean, once you hit the age of 65, they do recommend it annually for most people. For men, typically, they normally recommend after the age of 50 that you do get a bone density test done. This is something that if you talk to your physician about, they can perform this. It's normally not a problem. But it's more so just to make sure that you're less likely to have the issue of falls, because as we get older, sadly, we're more prone to falling and our bones don't function as well as they used to, so they do get a bit more brittle. The other thing is that they do recommend after the age of 40 that you do get a colonoscopy done every 10 years. It's the C word that nobody ever wants to hear, but it's a necessary thing just to make sure that there's no other serious issues such as colon cancer. That's a very common thing that sometimes you may not know the symptoms right away until it gets bad enough. For women, it's a little bit different. They do actually recommend that you do get a mammogram done between the ages of 30 to 49. But it varies from person to person. It depends if you have a family history or anything that would lead into that. So talk to your doctor if you have any questions or concerns about that, because that is something that they would have to bring up with you, or even talk to your OBGYN. The other thing is they do recommend that you do get a pap smear every 3 years, and that's more so to check for things like cervical cancer. So the main part that we're talking about today, actually, that's kind of our lead-in, is we're talking about 2 major vaccinations. The school year is kind of coming up now, so that college students are actually going off, and there's certain immunizations we always recommend to people that are going back to college or going to college and living in dorms. And there's some big ones that stick out, such as HPV and meningococcal. These are the 2 big ones. So with me today to kind of help talk about that today is I have my student here with me, Nate. Hi, Nate.
Hi. So my name is Nate Bohack. I'm a P4 student at Northeast Ohio Medical University. I'm really excited to be here today. Thanks for the opportunity.
Absolutely.
I think there's a lot of misconceptions, especially on social media, when it comes to the HPV vaccine. So hopefully we can try to clear that up a little bit today.
Absolutely. So yeah, with that, we'll kind of start off with HPV, see where things go here. So kind of starting off, can you tell us a little bit about what HPV even is?
Sure. So HPV stands for human papillomavirus. As in the name says, it is a virus. This can affect men and women, male and female. It can lead to various diseases, including certain types of cancers, which we'll talk about today. The big problem with this is until it develops into a further disease, there are really no symptoms. So many people don't know that they're infected with HPV. So would you believe me if I told you HPV is the most common sexually transmitted infection in America?
Really? Okay.
It is. So the CDC, all the numbers I'm about to talk about come directly from the CDC. They say that 79 million Americans are currently infected with HPV. and that is due to about 14 million new infections every year. So 50% of those new infections are male and female between the age of 15 and 24, so the younger population. So if you break that down, it's kind of a staggering number. 19,000 teens every day are infected newly with HPV.
Wow, that's incredible.
It is, it really is. And so we're going to go into this in more detail, but the problem is many people are not symptomatic, so they don't know that they should be avoiding contact. They don't know that they should be seen by a healthcare provider. So annually, over 30,000 men and women will develop cancers due to this HPV infection.
Wow. Okay. So that is a large number. So a lot of people need to kind of keep an eye out for that.
Absolutely.
So when we're talking about HPV, the one thing that does sometimes come up is that there's different vaccines and there's different things that are out there, and they're all focusing on different strains is the common term that you'll hear. So what can you tell us about the different strains that exist for HPV?
Sure. So there are a few strains that we look out for because they are higher risk, and then there are some lower risks. But to mention what a strain is. So a strain is the same virus, but it has a small change that allows it to do something a little different in the body and evade the immune system in a different way. So we have to cover multiple strains in vaccines to make sure that we're giving adequate protection. So the lowest risk strains that we know cause some sort of disease are strains 1 through 4. And these can just cause normal cutaneous warts, and they're not really transmitted through sexual action. It's just contact with another wart or person who is colonized with that. So then lower risk are strains 6 and 11. So these can develop tumors or masses in the airway, and they are also responsible for anogenital warts. So whether it be in the anus or the penis, it can cause warts in those areas. And then the highest risk are 16 and 18, and then 31 and 33. And so these are the highest risk because they're responsible, 16 and 18 are responsible for 65 to 70% of the cases of cervical cancer in America every year.
Wow. Okay. So kind of what you've already mentioned, is there any real way of knowing that you have HPV at that particular point?
Sure. So unfortunately for men, there's really no routine screening process. For women, there is. It's really important to have a pap smear done so that they can examine for the virus or abnormal cells. And it's paramount that we catch those cells as soon as possible, because the treatments for the developing diseases are the most effective when it is caught early, when the disease is progressing as rapidly as possible. So when it's in that rapid growth stage is when our interventions are most successful.
Yeah, so you, once again, kind of coming back to that point, we want to get it early so that we know what's going on with it.
Absolutely. So there's no cure for the actual virus, but if we catch the abnormal cells as early as possible, there's possible intervention to prevent progression.
Okay. So kind of talking about that, one of the most common things that comes up is, you know, if my child wasn't vaccinated or if I don't believe in the vaccination itself, what are some of the consequences? What are some of the concerns that you would have in the long term?
So cervical cancer is probably the biggest consequence that I think of. So it's, as we said before, it's very important for women to be screened annually. So when the virus enters the body, a lot of the time it goes away on its own. So that's a good thing. But unfortunately, sometimes it doesn't. And it can cause disruption to those cells that are growing in the cervix. It can actually lead to cancer. So it's actually estimated that 12,900 new cases of cervical cancer are diagnosed each year. That's about 35 women every day that are receiving a diagnosis of cervical cancer that's due to HPV. So most of these are in their teens to 20s. So the younger population are the most at risk. So that's why it's really important that we vaccinate our children before they become sexually active. That's a question we get from parents all the time is, well, my child is not sexually active. Why do they need that vaccine? Well, it's not to say that your child needs this vaccine now because they're sexually active. It's to say that we want to get the vaccine on board as soon as possible so the body has adequate time to provide immunity for that virus, so that whenever, if ever, they do come in contact with it, they've built up the immunity and their immune system can fight off the virus before it develops into something more serious.
Yeah, so we want to make sure that everybody's kind of got it covered prior to, regardless of what your activity is, just to make sure you're good to go.
Absolutely. And so a lot of parents come to me and say, well, my son doesn't have a cervix. Why should I be concerned? Well, as we talked about before, it can cause cancer in other places. So we have anal cancer in men and women, and it's usually asymptomatic until it progresses farther, but you can see minor bleeding as the first sign. So if we talk about numbers, not all anal cancers are due to HPV, but about 6,300 cases annually are caused by HPV.
Okay. So yeah, there's a small percentage of people that are prone to that.
Right.
Okay.
Right. And then again, we also talked about the warts and the. So we also have vaginal and vulvar cancers. So the vaginal cancer is usually asymptomatic early on, but it can be identified by like pain in the pelvis or discoloration of the skin or abnormal bleeding. Vulvar cancer is usually symptomatic though. It's usually pretty painful. There's a lot of discoloration of the skin, itching, burning, things like that. And so these are all possibilities with uncontrolled HPV.
Gotcha.
And as far as those go, about 4,500 women are diagnosed every year.
Okay. So a lot of women actually do deal with that type of thing year to year.
Absolutely. And so it's also important to think, so a lot of the problems we've talked about are female related, but men can be carriers. So men can have serious health consequences of this, but another important topic to talk about is preventing that transmission to their partner. So while some of the more severe cancers are caused in women, the men can be the carrier. So if everybody is vaccinated, we can prevent that transmission.
Gotcha. And then one of the other common things that I know a lot of people don't realize too is that if you are a carrier of it, there's a possibility that your children can have the potential to end up with it as well because you are that carrier.
Yep.
So we just kind of want to make sure that we're cutting off right at the top of it so that nobody else is being impacted by it, especially a future family, things like that.
Absolutely. Children can definitely be colonized through the birthing process.
Yes.
And so talking about genital warts, so 3 out of 4 people who come in contact with a genital wart will actually develop one on their own. And so there's no cure for the underlying virus, but there are cures for the warts. That being said, I would rather prevent them if it were me, because the cure is burning, freezing, scraping, things that are not really comfortable in a sensitive part of the body.
Words you don't typically want to hear when you're talking about trying to get something out. So.
Absolutely. And another number from the CDC that always blows my mind, 40 new cases per hour for genital warts.
Wow. Okay. That's pretty incredible how many people are impacted.
It is.
The United States in general.
It is. It is the most common sexually transmitted infection in America.
Gotcha. Okay. So kind of talking about that, we've kind of talked a little bit about the risks associated without getting it checked out or getting the correct vaccinations. So kind of talking about that in regards to treatment, you said that there's no real active treatment, correct?
Correct.
So what are the ways that we can help to kind of prevent it from occurring to begin with?
So education and prevention. So we do have vaccines that cover the most dangerous strains that we've identified. So there are so many, there are over 200 strains of HPV, it's hard to cover them all, but what they've done is they've included in a vaccine the ones that they feel are the most dangerous. So we do have a figure here that is from the CDC that shows the different vaccines we've used historically. Currently, the recommended vaccine is Gardasil 9, and so listed below are the strains of HPV that it covers. And again, you see that 16, 18, 31, and 33, which we talked about are the most common causes of cervical cancer. So we do have these vaccines, and they've been shown to be pretty effective in preventing these diseases. So who gets them? Well, the CDC says you can start at age 9, but it's generally recommended that between the age of 11 and 12, they start the series. And so this is kind of a new update. Prior to, it was a 3-dose series, and it was kind of a pain because you had to get 1 dose, and then 2 months later a dose, and then 6 months later a dose. So now they've studied this 2-dose regimen, and it was found to be non-inferior to the 3-dose, which means for the audience that it did no worse of a job at preventing HPV. It was not better, but it did an adequate job compared to the 3-dose strain. There was no difference in infection. So and it's much more convenient. So you get 1 dose, and then 6 to 12 months later, you get your 2nd dose. So you can kind of see, for parents, it's a lot easier because we can just do the 1st dose and the 2nd dose in line with our yearly physicals like we talked about. So a catch-up schedule is recommended for women age 13 to 26 and men 13 to 21. And so ideally we want to get everybody before they become sexually active. I think that's really important for parents to hear. Doesn't necessarily mean that we need to wait until they're sexually active when they're going to have the risk. We want to get to them before that happens, and so they can develop immunity before they come in contact with the risk.
Okay. Yeah, so in case there's any problems or concerns, this is one of those things where we always want to make sure that if you have questions, we have the visual so that people can kind of read it, but the reality is if anything comes up, by all means, please ask your pharmacist, ask your physicians. They're the trained people that are giving these immunizations that typically know the schedules. And the CDC website is a great reference too, where they have a list of all the different vaccines, so it kind of makes it a little bit easier to read it in a kind of laid out schedule in case you forget, if I did get that 1st dose, how far along do I need to wait, or to get your children those doses as well.
Absolutely.
There are a few questions that some people are always asking, and the number one thing that's going on right now still is that, is the vaccine itself safe? Because there's a lot of controversy about vaccines being effective, and, are they inducing some kind of, autism or anything like that? So with these vaccines, what is your recommendation?
Boy, so we could sit here and talk about this all day, and certainly it's a very heated subject. My impression is from the data, so every vaccine that's administered is recorded, and every adverse event that is reported from a vaccine is reported in the VAERS. And so the CDC looks at all this data, and they've done many studies on this, and they found that really there is no difference in adverse events comparing a vaccine to placebo. As far as autism goes, I think the general consensus in the medical population is that we're getting better at diagnosing this, and we're getting better at detecting that early. As far as Guillain-Barré, which is a life-changing incident, it's really thought that when somebody has another infection, so like the flu or Campylobacter, which is another bacteria, these disease states can cause that on their own. And so if you look at people who receive a vaccine versus placebo, there is not a higher incidence of Guillain-Barré in vaccines compared to the placebo. So my impression is they are safe. Those incidences are very rare. So even if for a second we said, okay, well, maybe there is risk, we know that HPV causes 70% of cervical cancer, and we have a vaccine for it. So even if for a second we consider those possible negative outcomes, I really still think that there's so much benefit with this vaccine that I would still make the decision to use the vaccine.
Perfect. And then the other thing that sometimes people ask is, we did talk about a series of shots. Now, is this something where it's like tetanus or like the flu shot, where it's something that you have to consistently do over and over again, or is this just kind of a one-stop shop?
So this is a one series kind of thing. So you get your 1st dose, and then 12 months later you get your 2nd dose, and then that's good for life. So you don't need an additional booster 10 years down the road or 20 years down the road.
Perfect. All right. So we kind of covered a bit about HPV there. We'll kind of shift over now. So meningococcal, it's a little bit more straightforward with that one as well. So what can you tell me about that as well?
So I guess first we should define meningitis. So meningitis, there is a protective layer around the brain called the meninges, and when those are infected or inflamed, that's what we refer to as meningitis. One of the things that can cause this, and we have a vaccine for, surprise, is Neisseria meningitidis. And so we're kind of shifting frame a little bit, and we're talking about a bacteria now and not a virus. And so what is the worry about this? Why would I be worried about catching something from somebody who has an infection in their brain? Well, it's colonized in the nasal passage, and it's actually transmitted through respiratory droplets. So if I'm colonized with Neisseria meningitidis and I sneeze on the table and you touch it, congratulations, now you are too. And so we're going to talk about certain populations that are at higher risk for this transmission, but kids that live in dorms and military recruits, because they live in such confined quarters that they come in contact with other people so much, they're at very high risk for this transmission.
Gotcha. Yeah, and especially when you're talking about shared areas, shared spaces, ventilation systems is very common sometimes to transport some of these droplets. You got to be real careful about that. So, yeah. Now, there's different people there's different forms of the bacteria that exist. So what are we mostly concerned about here with that?
So like our strains, we have what we call serogroups. So our meningococcal conjugate vaccine is the vaccine that everybody should get. And then there's a serogroup B, which isn't covered. The B group isn't covered in the main vaccine. So this additional vaccine may be given to everybody and should be given to some people. So everybody from age 11 to 12 should get the meningococcal conjugate vaccine and then receive a booster at age 16. And any child may receive the serogroup B vaccine. So the children that should get the serogroup B vaccine include those who have a rare immune disorder, if they're on certain immunosuppressive medications, if they have a damaged spleen. So the spleen's job in part is to help us fight some of these bacteria that have what we call a capsule around them. And so that capsule is like a protective coating. And one of the things it does is it helps evade our immune system. So the spleen's job is to try to help us fight those. So if they have a damaged spleen, or if they have like sickle cell, so sickle cell, we have damage to the spleen, so those children should receive the serogroup B because they're at a higher risk of not being able to fight that off. And then, of course, if they're in any population where the serogroup B strain is identified at a higher rate, so wherever that geographically or whatnot.
Okay.
And then so if we look at babies and children, they break it down a little further, and this is kind of the kids who are at a higher risk. So any of the children, babies and children that are at a higher risk should get the vaccine earlier. Also, if they're born with HIV, that would also qualify them to get the immunization earlier. So for these little guys, we start between 2 months and 10 years old. So if they meet any of those qualifications, they can get the vaccine earlier than they normally would. Serogroup B can also be given to these children if they are at a higher risk for coming in contact with serogroup B. As far as adults, it's kind of the same thing. So any college student who's going to go to school and live in a dorm and it was not appropriately vaccinated prior to going should get that. And then military recruits. And then they also break it down with the serogroup B, a lot of the things we've already talked about. They also throw in microbiologists who constantly work with Neisseria meningitidis. Those guys should definitely get the serogroup B vaccine also.
Yeah, I was going to say, if you're working closely with it, it would make sense to make sure that you're not going to catch it and spread it. So yeah, that makes sense.
And then so those who should not get this vaccine, so if you're pregnant or breastfeeding, should wait until that is done. Children who are not feeling well. So the CDC kind of says, so like if you're not feeling that great, if you have a little cold and it's not affecting your daily activity, it's okay. But if you are ill enough to the point where you would do something different in your day or it impacts like what you would do today, then you should just wait until you recover so that your immune system is on par and you can get the best immunity. And then they say 1 in a million actually have an allergic reaction to this vaccine, so if that should ever happen, you should not get the follow-up dose.
Okay. And typically when we're talking allergic reactions, I always tell people what constitutes an allergic reaction is a little different than just having some pain, essentially. So if you're getting site injection pain, like the redness, the soreness, that's bound to happen with most of your immunizations.
Sure.
However, if we're talking, trouble breathing, if it feels like your chest is a lot tighter than normal, if you start having a rash that's forming, especially around the chest or face, these are constituted as allergic reactions. So these are the ones that I highly recommend letting your physician and your pharmacist know just in case there's a problem. So. Now, in regards to, are there any major problems with getting the vaccine? Because I know I touched on a little bit there, but was there anything else that really comes to mind?
So we kind of have like the redness, the injection site pain. So we're recruiting the immune system. We're causing maybe some inflammation. So it's expected that we can have some swelling, some tenderness. This can last like 3 to 7 days. If it lasts longer than that, you might want to mention it to your healthcare provider. Another thing is some people get faint when they receive a vaccine. So it's not a bad idea to sit around for 15, 20 minutes just to make sure you're feeling yourself before you head off.
Okay. Yeah, knock on wood, I have yet to have anybody faint on me yet, but it's always a possibility. I've heard some horror stories from other pharmacists as well. So yeah, we want to be on the safe side. So they do have recommendations to at least sit for at least 10 minutes, but I know some people are always in a hurry. So based on that information, it's the comfort level of the pharmacist or your physician, whoever's administering it, just to kind of wait around just for a while.
Yeah, and a lot of the time these people know. I do happen to have a friend who does not do vaccines very well, and he gets a little faint, so he sticks around for a little while.
Yeah.
But it's really important to know yourself and to know what your body needs.
Perfect. Well, I would say from the looks of it, that kind of covered everything. Thank you, Nate, for all the information today. The main thing that I always like to tell everybody is that if you have any questions, concerns, make sure that you're talking to your physicians and your pharmacist. We're your number one go-to when we're talking about especially immunizations or general health care. If there's something that seems severe, they can at least guide you if they cannot answer your question for sure, where you need to go. But for today's episode, that kind of concludes it. Once again, if you guys have any questions or you're interested in learning some more, please check out our previous episodes. But until next time, thank you so much.